Okay, Councillor Corthorne, we're live, so you can start the meeting when we're ready.
Welcome to a virtual meeting of the Social Care, Housing and Public Health Policy Overview Committee. This virtual meeting is also being broadcast simultaneously on the Council's YouTube channel, Hillingdon, London. I am Councillor Philip Corthorne and I am Chairman of this meeting. Before we start, some important online housekeeping for everyone present. Please ensure that any mobile phones around you are on silent. If you're wearing a headset, ensure your microphone is away from your mouth to avoid noise when not speaking. Please keep your microphone muted when not speaking and then unmute to speak. Only one person may speak at a time and I as Chairman will call those to speak. And now, before we move to the agenda, I'd like to do a roll call of all the councillors present to confirm attendance. Please indicate you are present when I say your name. Councillor McQuarrie.
Good evening, I am present.
Good evening. Councillor Cooper.
Good evening. Good evening, I'm present.
Good evening. Councillor DeVille.
Good evening, I'm present.
Not at the moment, I don't think. No. Okay, we'll move on for now. Councillor Eggington.
Yes, good evening, I'm here.
Good evening. Councillor Gardner.
Good evening, I'm present.
Thank you. Councillor Hagar.
Good evening, I'm present.
Councillor Rodriguez.
Good evening, I'm present.
Good evening. And finally, Councillor Tuckwell.
Good evening, I am present.
Thank you very much indeed. Also, can the officers present indicate they're at the meeting? So I've got Judy Kelly.
Present.
Thank you. And Steve Clark, Democratic Services.
Present, Chairman. And just to note, Councillor DeVille has joined the meeting.
Okay, I suppose to be correct, I should ask Councillor DeVille then to register. Councillor DeVille?
Yeah, I'm present.
Thank you very much indeed. Thank you. I understand that Tony Zaman may be present, but he hasn't confirmed. So I'm taking he's not on the call at the moment. If we hear otherwise, but no doubt we'll let you know. Okay, so in terms of technical meeting control, if any councillor leaves the virtual meeting partway through for a period of time, for example, for a lost connection, I will continue the meeting unless we are not quorate, which for our purposes today is 3 councillors. So we turn to the agenda. Before I do that, I will just say that I'm experiencing a little background noise on my own computer. If it's necessary for me to move to my phone, we may just have to suspend the meeting briefly to allow me to do that, but hopefully that won't be necessary. And with that, apologies for absence this evening, please.
No apologies for absence this evening, Chairman.
Thank you, Steve. And declarations of interest in matters before this meeting. Are there any matters to declare? I'm seeing no indications, in which case I will move on. Thank you. And then point number 3, to receive and agree the minutes of the meeting held on the 25th of March. Can I ask if members agree that the previous minutes are an accurate record of our discussions? Any indication to the contrary? Okay, thank you. I will just say a couple of things on the minutes, so if I may. The first one is just in relation to the autism review. There was a suggestion, I think, from Councillor Eggington that we include an aspect that relates to the Ombudsman case. There's some separate wording has been agreed on that. I think Councillor Eggington hopefully will acknowledge that that's been agreed. The Ombudsman, sorry, I've mentioned the Ombudsman case. The point about the DWP from Councillor Gardner, we've got a response coming on that, which we don't have yet. And in relation to EHCPs and SENDs, I did say I'd pass some information on, and you've now had that. So just those 3 things to say about the minutes. If you're otherwise happy, Councillor Eggington, you're indicating.
Yes, thank you, Chair. I think under item 58, there's reference to a briefing note that there was the officers were going to share the findings of the report with members.
Okay. Yes, I picked that up with Steve Clark today. Steve, can you help me out on that, please?
Yes, so we've got officers looking at that today. They're going to be coming back back on that one very, very shortly. It's the Ofsted inspection report, I believe, or the findings from those Ofsted visits. Yep. So we'll have officers coming back on that imminently.
Okay, so that's to follow, Tony, but that's noted.
Thank you.
Are we otherwise happy? Okay, thank you very much. No one else is indicating, so we'll move on. And the point 4, to confirm public and private reports, all items to be heard in part 1. And with that, we'll come to our first report for the evening, which is the semi-independent living update, which Julie Kelly, who is Director of Service Delivery, Children's and Young People's Services, will present to us. So can I say over to you, please, Julie?
Yeah, of course you can. Well, good evening, everybody. It's quite a short report, so I hope that was helpful. And it's an updating report because I believe report was presented last year, around about February last year, just before we entered lockdown, on our proposals to move from our large-scale provision, particularly Olympic House, to provide more bespoke home environments that provide supported living accommodation for our care leavers. Luckily, we managed to do that just before we were locked down and stopped. So the closing of Olympic House happened. Our young people were offered options and choices of where they were to live, and we were able to move all those young people on into more appropriate semi-independent accommodation. We weren't quite as successful as moving everybody on in the YMCA because things quickly moved into lockdown, and we're continuing that process of moving people on. From the report, I suppose the biggest thing that I'd want to bring to your attention is the impact of COVID. Because although we were successful in moving on into semi-independent living, young people moving from semi-independent living into independent living have been held back as a result. There was government direction not to move people at a certain point in time. There's also an issue around accommodation for the 18 plus. So there's been quite a bit of work going on to move young people through that pathway, including the commissioning of some of our own accommodation for our 18 plus children, again linked to the quality. Also alongside that, we've moved to our all-age brokerage service that covers adults and children, which will hopefully give us a far more business focus and a focus on quality of the semi-independent accommodation. Councillors may or may not be aware that this has sort of been big news really in terms of media attention, and particularly for under 16s in Hillingdon. Well, as long as I've been here, and I think from before, we've never placed under 16s in semi-independent or supported accommodation in that way. But we know that the DFE, Ofsted and the government are keen to have a look at that provision for those 16 to 18-year-olds, and to try and we don't see that becoming regulated, but we do see this real push for accreditation. So as the report says, we have signed up with the WLA and use that as a vehicle where possible. Where we have a lack of capacity, because the WLA have a bit of a backlog as well. There are providers that are on that list that want to be accredited, but that involves going out and visiting properties. So this year it's taken a bit slower than we would like. We are applying those same standards. So we have a quality assurance officer that was initially based in children's placements, but is now a role within the brokerage, so that we ensure that the WLA haven't accredited and been out and visited, that we are doing that before we place young people into the semi-independent accommodation. I think that's sort of overview, but I think it's probably best that if I take questions rather than guessing what questions that you might have about it. Would that be helpful?
Yeah, indeed. And some people are indicating already, but I'm going to jump in, if I may, with the first one, because what immediately occurs to me, really. I mean, you talk on page, at the top of page 8, I think, about the quality of support available. In our view, when the review was undertaken in 2019, it was variable. I'm wondering, I mean, you're talking about market management. I wonder to what extent there is still an opportunity, in your view, and where there are gaps in the market for provision of the required quality. And where are we on that journey from the review in 2019 and now? How do you see it now compared to 2 years ago?
I would say it is better. I think we are more assured that our young people are in better quality accommodation. But there is increased demand. So I think the honest answer is I think there's still more to do, because we are going to need more providers. We are going to have more capacity. Our care leaving population, being the Hillingdon the Port Authority, and our increasing as more unaccompanied young people come through, we have more care leavers that require that accommodation. So it's an ongoing piece of work, and the brokerage team itself only came into being in February of this year. That was a delay. It needed staff consultation alongside the rest to put in place, and staffing there is just in place this month. So we're doing a bit of a hybrid, really, of using children's placements and some of the staff in that service. So quite a way to go, but we're really working closely with the WLA and ensuring that we're getting the most for our investment in that vehicle as well. And as we see lockdown easing, we're already seeing it. There are more visits, there are more people coming onto that list, more providers that are accredited, and that we can be assured that the accommodation is of good quality. But we will continue to do our own checks as well. We will, we're part of the WLA. We signed up to that accreditation process, and I respect that process. But our quality assurance officers, there will be an expectation that they will also continue to do some monitoring of that once our young people are placed there. So there is still work to do, and demand is increasing for our young people.
Thank you very much indeed. Now, Julie, a number of people have indicated. I'm afraid I didn't see in what order, so you'll have to bear with me, I'm afraid, if I may. No particular order. Can I take Councillor Tuckwell first, please?
Thank you, Mr. Chairman, and thank you, Julie, for presenting the report. Short report, but covers a lot of ground, I think. Just one question for me, really, and I'm interested to sort of, and you might have covered it off, and it might be sort of in some of the text here, but I'm really interested to understand how we support the transition between sort of, when they reach sort of the end of their childhood at the age of 18, and they go into sort of like 19, 20, 21. How do we manage that transition? Because some of the youngsters will be need more support than others. So I'm just interested to understand how we manage that.
Yeah, I think that process starts a lot earlier in the young person's journey. It depends when they come to us, though, because some young people, given our demograph, will land with us around the ages of 16 and 17. So we play a bit of catch up and getting to know them. But in the main, for a looked after population, that work really starts about 14, really understanding what their needs are and if there are any additional needs. There is opportunity, and most of our young people will retain a social worker up to the age of 18 and not just transfer to a PA. Our legal responsibility is at 16 they can have a personal advisor. I'm confident in our personal advisors, and they're very well skilled, but the needs of some of our young people really mean that they need that social worker to acting as their corporate parent and their corporate parent for us. We have a transition panel process where we look at young people's needs, particularly those who maybe post-18 are going to have additional needs, whether it's around the mental and emotional well-being, if there's a learning need, or if there's any kind of disability. So if there's any ongoing, we will present that to transition panel, which is, it's not really a decision-making panel. It's where we go and we get together with our colleagues and adults, potentially colleagues in housing and colleagues in mental health, usually, to just look at the young person's needs and really think about how we plan that transition for them. What we're really focusing on is choice for our young people as well, in that preparation for adulthood. So as they come to 18, when they will have personal advisor support up to the age of 25, we're now able to offer them the choice of personal advisor as well. So they're given the profiles, they're given an understanding of who it is, so that they can try and make decisions and choices for themselves and deciding who will help them in that independence journey. And that's been received really well. And I think we see greater engagement from young people, which isn't surprising. I think it's similar for ourselves. If we choose a service, then we're more likely to engage in that service and get the most from it. Young people who we think aren't ready for independence at 18 fully, they will come through our HEART process, where we decide we can extend it. And we do have some young people post 18 in semi-independent accommodation, because actually we feel they need that bit longer to transition, and that's maybe often young people who haven't gained the skills that they need to be independent yet and have come to us later in their journey. So there's quite a lot of work that goes on 14 plus, really thinking about that transition. But the transition isn't just about semi-independent living, and for our young people in foster care, we're really trying to promote and push stay and put arrangements with foster carers, because again, I think that more accurately reflects the needs of young people and how people live their lives just now. I know that when, without disclosing ages, when I was younger, people were probably independent at an earlier age in terms of employment. Young people tend to stay at home a lot longer now, and we're trying to replicate and provide some of that support for our young people through our stay and put with foster carers. So there are a range of options for them, and some of our young people go to university, so we have to look at halls of residence and then those respite or holiday. How do they come home? How do we ensure they've got somewhere to come home in holidays as well?
Julie, thank you. Is that okay, Councillor Tuckwell?
Very, very comprehensive. So it answered my question and more. So thank you, Julie.
Okay, thank you very much. Again, in no particular order, Councillor Eggington, please.
I think it should be Councillor Gardner actually next.
I beg your pardon. If you're happy to defer to Councillor Gardner,
Yes,
then I shall call her first. Janet, please go ahead.
Yeah, I've got a few comments on page 7, the after introduction. On to the third paragraph down. I'm going to be a bit pain here, where it says the support offered should be targeted to promote preparation for adulthood. Could should be changed to must, because should is sort of like maybe not. I mean, I wouldn't like anybody to pick up on that. I think it should be, but maybe not. Does that make sense? Also, on the following page, on to last fourth paragraph down at the end, it says this will be about house. That's for young people to 100. This will be for young people over the age of 18 who will require housing-related support only. What does the housing-related support actually entail? Yeah. And then the other one, which is the following page, sorry to be a pain, page 9, second paragraph down, we've got currently have 20 young people in staying put arrangements. What is the financial outlay for that? Because I appreciate the foster carers get a fostering allowance. Do they carry on getting that, and do they give the young person a portion of that, or do they get the fostering allowance plus us giving money to the children that they're supporting?
Okay, I think I'll take your 3 points from. Okay, I'll take the three points from. Hopefully, I think that the easiest answer to the more complex, the easiest answer is, yeah, you're right, it should be must, and we have a duty, and we do prepare young people for independence. So that's right now. I will take that on board. The housing only support that we were looking for, that means, or when they've done the review, the young people who are, by all intents and purposes, have those independent skills, but they need to be housed. That is basically what that means. Their need is for housing. They don't need additional support around, personal development, education, whatever it is. They are already independent and able to do that, and they are probably a smaller proportion at that age. The staying put, I don't think I probably have time to go through all the details, but we do have the staying put policy that I will share. But it's not a continuation of the fostering allowance. There is quite complex mathematics and legal processes to go through to do that. So the young people also pay a contribution if they're in receipt of benefits because they're post-18. So it's quite a complex process, but we support our foster carers and our young people to understand what that is. Foster carers should still have a financial reward, but it's not the fostering allowance. The stay and put policy is quite long, but I think it's probably a good idea that I maybe share it with the POC and send that into Steve for you to have a look at. But we do receive a level of grant funding from central government to cover our stay and put costs. But there are some additional costs that come out of our base budget as a result that some of our young people, for example, our unaccompanied young people, might not have their remain and their immigration issues settled by 18 and therefore can't access some of the benefits, and then we would have to top up some of that to ensure that the foster carer still receives the correct level of financial support. I hope that's helpful, but it is quite a complex financial bit like financial Jenga to work it out. It's probably best that you have a look, and then if you have any questions or want a follow up on staying put, I'd be more than happy to provide that.
Yeah, that would be fantastic. Thank you. Can I just say something which is a little bit flippant? I wish I'd had a personal advisor up to the age of 25. I got married at 18. Somebody should have told me I shouldn't have done it. Anyway, sorry.
There you go, Janet. So the staying put information would be helpful, Julie, if you can share that. That's really good. Okay, let's move on. Councillor Eggleston, can I come to you now, please?
Thank you, Chair. Yes, it's quite a brief report, but it's got quite a lot in it, I think. What does, I think, it is lacking the numbers, really, which it talks about, in certain cases, the fact that there are some percentages which you've included, but in general, I don't think there's a great deal to explain exactly how many young people are in the semi-independent living accommodation and the unregulated accommodation, in other words, and how many are in other, whether they're, as you're putting, staying put. So it would be useful to know that. What in particular I wondered was, clearly there are quite a lot of young people who are in care who have greater needs and need greater support. And my understanding is that the unregulated accommodation which we're using for over 16-year-olds cannot by law include any care. It can provide support, but strictly care, although that's not actually defined as much in law. And I wondered how it was determined which young people could go into the unregulated independent, semi-independent living accommodation. On top of that, I wondered whether, with the staying put and for young people remaining with foster parents or in a foster family, whether that's affecting the provision of foster care for other young people and children in the borough, and whether there is enough foster carers available. And then finally, you mentioned the accreditation process, which is provided by the West London WLA Alliance. Can you provide details, perhaps not at this meeting, because it's probably quite, but details of what that accreditation involves?
Okay, thank you for that. In terms of, let me try and keep up, and if I miss out one of your questions, do come back to me. How we decide who needs sort of what or who's ready for semi-independent accommodation is an ongoing process, and it's usually done through the Looked After Children reviews, which are multi-agency reviews, which include the children, and if they have parents that are still involved, they're also involved in that, and has the independent oversight of the IRO. You're absolutely right in terms of they can't provide care, but support is a type of care, isn't it? It depends what they need. And their semi-independent accommodation, it's not a one-size-fits-all. Some of the block bookings will provide 5 hours key working support, but some of our other more bespoke packages, it really depends on what the young person needs. And some young people can have up to 15, 20 hours of support if that's determined. And that's reviewed through their LAC review and then agreed and signed off via HARP processes, and is always kept under review. The expectation is that needs should reduce, because if we're doing our job correctly and the semi-independent providers are doing the job correctly, then our young people become more independent and therefore those needs decrease. But that's generally the process and how we decide who wants what and who needs what. And it really also depends on what the young person feels. Some young people are absolutely desperate to go out there and have a go at it, and we think they potentially could, and we will give them that support to do so. Some young people are far more apprehensive and they might take a bit longer. So we need to really think about what the young people want as well as what the professional network thinks. In terms of the breakdown, I was just following up from the last report, and again, I'm not going to do it off the top of my head. I know in terms of the smaller numbers and staying put, etc., I know that we also still have sort of 40 plus, 18 plus is in semi-independent accommodation. But I can again provide that data and a breakdown if you wish, because it is available to us, and give you an up-to-date picture of where our care leaving population are, whether it's in foster care or university or supported accommodation. So I will do that. And similarly, the details of the accreditation were in the previous report, but I will ask Hassan Hajjaj, who is now managing our brokerage service, to pull together just a quick brief guide to be able to be shared with Steve around what that means, expectation. And a lot of it is around building service provision, you know, DBSs, lots of things that you would expect, those safeguards that you would expect, and monitoring visits. But rather than make it up off the top of my head from the last time I looked at it, I will ensure that I send that through to you. The point around foster care is interesting. I think at this point in time, because we don't have huge numbers of staying put, it hasn't had a negative impact on, you know, keeping foster carers and recruiting them, but it is a potential. So that goes alongside the work that the Fostering Recruitment Overview Group are undertaking to. We've just recently pulled together a new campaign and targeting to try and have foster carers who will care for our young people, particularly adolescents and older teenagers, because those are our young people that in our borough particularly that really need that. And this year we're proposing a bit of a bid review around our fostering offer to foster carers. We haven't done that for quite a while, and we'll look at is there something that we need to do a bit more tiered to make it more attractive to provide homes and care for that group of young people. So not an impact yet, but if we're successful in it picking up, it could have. So we need to keep that fostering recruitment work ongoing to ensure sufficiency. And we do use independent agencies as well. If a young person needs a foster placement, we are able to provide that foster placement, whether it's in-house or via agency procurement. I'm not sure if I missed anything, Councillor Eglinton.
Is that it, Tony?
I think so. Could just one extra bit. Are all of the young people who are in semi-independent living, are they all within Hillingdon, or are they spread out over West London?
I think that they're spread. There's quite a lot of provision in Hounslow, so in neighbouring local authorities, it depends on where the providers are. But we try to keep them as local as possible, and also where they were before for young people. So if they were maybe living in a particular area and they already have those community networks, we'll try and source them a semi-independent provision with that. So we have some provision as far afield as Birmingham, because a young person happened to maybe be in the residential unit in Birmingham, and that's where their friendship and support network or employment and education are. But the majority are West London based.
Thank you.
Julie, thank you very much. Now, I've got Councillor Hagar and I think Councillor Cooper indicating still, so I'll take Councillor Hagar first, if I may.
Thank you, Chair. Some of the questions have actually been already asked, but I do have one question. Can you just tell me, I was really interested to hear about the support that we're offering our young people, especially in light of COVID and, as you said, about the isolation. Can you just tell me what we're going to offer, or what support have we got planned to offer as we come out of COVID, and with regards to just keeping them in contact with everyone? That was the first question. And the second one is, do we feel there's going to be an increase in children in care afterwards? So do we feel, or do we see that we might have an increase? Thank you, Chair.
Okay. In terms of our young people and the keeping in contact, I think we learnt a lot over the last year and how we could do what we do better. And some of those things, even if miraculously by next year everything is back to whatever normal looks like, we will want to keep some of those, you know, those check-ins. And young people, the feedback that we've had from young people has been overwhelming. And next year I'm really looking forward to seeing my complaints and compliments report for a change, because young people have come back a lot and said this has made such a difference to us. You know, the checking in of the phone calls, the texts, that informal thing that young people really engage with. So we will continue doing behind that. We're also working. I suppose it's not it is an overall strategy, but it is through the LAC reviews. We are having to look at our young people and what the impact of COVID has been, whether it's in their employment prospects or their education, if there's any catch up, and ensuring that we also have a bit of a recovery plan for each of our young people as part of their looked after reviews or the reviews of their pathway planning. So that's in terms of more young people coming into care. I really hope not. And we are preparing for more need within the community. I think we're going to see it more. We're already seeing that. We saw it as the last lockdown eased, particularly at the front door. We will start to see that again. I think it's been, I wouldn't say quiet because it's never quiet, but children only went back to school fully on the 8th and then we've had the Easter break right now, so we're not really seeing that impact. I think we will see a real increase in contacts. To hopefully help us manage that, we are just launching on the 3rd of May the real transformed early help offer across, and we're really hoping that that will help divert and hope that young people don't come into care, and actually if they don't need a social work service they still get a service. And early help, it's a bit of a misnomer really, because it is really just help, and it's having that stronger families hub at the front door where people can contact when they need help, and then we can work out who's best placed to offer them that, rather than a bit of a, well, you come in here and you have to have that assessment. So there's been lots of work going on this year, and we're moving as well to the 24-hour triage. So the Stronger Families Hub will be operating 24 hours a day, 7 days a week, and not just relying on that emergency service. It will still be a residual service because I won't have 5 teams of, referral and assessment officers and 6 teams of SIN and CP workers working through the night. But we will match the need as we see the volume increasing, and hopefully that will enable us to be a lot more responsive than we have been before. But we will definitely prepare for increased need, but hopefully not increased numbers of looked after children as a result.
Thank you, Julie. Councillor Haggard, does that answer your question?
Yes, thank you so much. That was really, really helpful. Thank you.
Lovely. Okay, I'm looking around. No one else seems to be indicating. There's a double C indicating. Apparently that's me, but my hand's not up. So I will nevertheless ask just one closing question then. In that case, I note different references to getting feedback from some of our young people, and it's so important that whatever we do, we validate what it is we're providing, and the effectiveness, the impact it has. And I was interested in the young inspectors bit that's referred to in the report. And that's obviously been held back like many other things due to the pandemic. I wonder if you could just give me a brief explanation about what we've got in mind with that and how we see it working, please, Julie.
Okay, we had started it, but you're right, it came to a stuttering halt because it involves young people going out into the community and visiting provisions. But it's using the groups that we have in our Children in Care Council. So we have 3 groups, 3 different age groups. We were using the 2 older age groups to really be supported to go out and have a look at our provision and tell us from their point of view whether it's good, bad or ugly and what we could do better. And they were really influential in our review of Olympic House. And, they came and they had tea with myself and Tony Zeman as well afterwards and told us what they thought of that provision. But the idea is it will be more systematic, and as we come out of this COVID crisis, the part of the quality assurance officer's role in brokerage will also be about commissioning those young inspectors, getting them skilled up to come and do it. And in a previous life, the CAFCAS, the Family Justice Young People's Board, have been doing that. I previously worked in CAFCAS, and they would then come and inspect all area offices and tell us actually what it feels like to be a young person coming through the door. So we're using that model to really bolster these young inspectors. But I think their feedback is absolutely invaluable. And sometimes it's the little things that we don't see when we're busy looking at sort of bed management and how we manage the business and to what it feels like for a child stepping over the door. But they've been fabulous, and we're really hoping to restart that sooner rather than later.
Good. Thank you very much. Julie. I'm looking around and no one else appears to be indicating, unless I'm much mistaken.
Sorry, Chairman, just a minute. We've got Councillor Cooper.
Philip,
Councillor Cooper, I beg your pardon. Apologies. Do carry on, please. Oh, Councillor Cooper.
Mute,
I think you're
Councillor Cooper.
Can you unmute Councillor Cooper, please?
Okay, she might be having some issues there.
Bear with us a moment, please. We'll see if we can resolve this as quickly as we can.
Are you able to unmute now, Councillor Cooper? If you just try again. Okay, I'm not sure we're going to get any response there. Apologies there for Councillor Cooper. It looks like it's technical difficulties at the moment.
I'd love to hear from you, Councillor Cooper, but I think we might have to move on in a moment, to be honest, having tried to resolve that, unfortunately. Okay, well, I'm sorry about that. I'm not sure what we can do in the circumstances.
Chairman, may I make a suggestion, please?
Yes.
If Councillor Cooper's able to write in the chat function her question, perhaps Julie can then answer it if it's possible.
If it could be done reasonably briefly, I suppose, Steve, we can do it that way, couldn't we?
Yeah, of course. If you can.
Would you like to do it that way?
I'm getting a shaking of the head from Councillor Cooper.
Okay. Well, it was a worthy suggestion, but apparently not. Councillor Cooper, my apologies. I'm sorry we've not managed to resolve that, but I think we're going to have to move on in the circumstances. So, thank you. Okay. So, if there's no one else indicating, let me just say, Julie, I'd like to thank you very much for the report. It's a light report. There's plenty in it, if you like, if that's contradictory. But this is obviously another very challenging area of service. It's enormously important for our young people, and I think we very much welcome the work that's being done to drive up standards and to go for accreditation and to improve standards as best we can. Managing the market is very important as part of that, of course. And there's been an additional challenge around the pandemic, which we're very aware of. So please take away our thanks for your efforts and for those of your colleagues. And I think with that, I will just come to the recommendations that we have before us, that the Social Care, Housing and Public Health Policy and Review Committee note the report on semi-independent living. Can I take it that we're happy with that? No one's indicated to the contrary, so we'll move on. Thank you very much indeed. And Councillor Cooper, again, my apologies for that. So the next agenda item we have is the topic proposals and selection phase for the next major review. And there are a couple of aspects to this which we'll pick up. The first one, hopefully we can deal with fairly briefly. Earlier today we were circulated with an amended recommendation 5 from our autism review, and I'm just going to read it out for benefit of any members of the public who are watching and who may have missed it. I'll just read it out. The revised recommendation is that the Cabinet welcome the culture of continuing improvement, and such improvements are the appointment of advanced social work practitioners with a focus on autism, the development of e-learning training and clear council-wide guidance on reasonable adjustments under the Equality Act 2010. The rationale behind that altered recommendation is that following the amendment to recommendation 5, that's very much around the council's reasonable adjustment guidance, which was published in October of last year, which is applicable directly in this situation rather than policy. And also the relevant legislation is in fact the equalities legislation, not the Disability Discrimination Act. So we're just correcting those two aspects in the recommendation. Are we happy with that, or any comments or questions? Okay, we seem to be happy. No one's indicating to the contrary. Thank you very much indeed. And then coming on to the sort of meatier item that we've got to consider now, and that's the choice of our next topic. I mean, this is a new thing for me. I've not been involved in selecting a new topic before. I think you're very conscious when you're involved in the POC of the contribution you can make to the wider work of the council. It's a very important role, and it's important that we play that as best we can. Officers have fleshed out 4 feasible options in terms of what we could look at next, and they're all before us in the report there. There's also been a little scorecard prepared, which I'll come to in a minute, a little bit later on under Appendix B. They're all very meaty topics, and the difficult thing is choosing one that we're all happy with. Whatever we decide, there's no doubt that we can certainly take all of these at different stages in our work programme, because they're all very worthy things. But to get this conversation rolling, I'm going to suggest a way ahead in relation to one of these, because for me personally, there's only one that really stands out at the moment in terms of its relevance, how current it is, and there's an immediate imperative to actually get moving on this, and that is the one that relates to assisted living. And I'll take a moment to just explain why I think that is. Assistive technology is very well established in our sheltered and our extra care schemes, and indeed in many people's homes across the borough. And it works well, but there is so much more we can do potentially with assistive technology that we are not harnessing as fully as we could at the moment, that could promote wellbeing and independence. You may have noticed in the recent past, the Cabinet have extended the existing contract with Anchor Hanover for the work they do at our sheltered care home schemes and elsewhere. Part of the rationale for that was to allow for options to be looked at in terms of what service provision looked like in the future, how it could be developed. So it seems to me that given the imperative, the whole health and wellbeing agenda, the whole out of hospital strategy which we're moving towards, it seems to be certainly very current in terms of the options that are before us. The one I will just touch on one other one that's come forward, and that was the one about promoting healthy lifestyles post-pandemic. And I do want to say something about that, because the scorecard, you'll notice, actually rates it marginally higher than assistive technology, and I just want to explain that. The scorecard really was completed by 4 different officers. It is entirely subjective, and it's there to inform our thinking rather than decide things for us. My thoughts really on that is that given where we are with the pandemic and coming out of lockdown, we're still very much at an early stage. We're not there yet by any means. We're not out of the woods. There's some time yet to get to the recovery phase, and my view is that it would be better picking this up later when we've addressed and understood the impact more fully as people start to access services like GP appointments and what have you. The other thing I would say is this review is also less focused at this stage. This is a time when public health and clinical capacity is very much under pressure still, and I think their ability to contribute at this stage to this kind of review is perhaps limited. So you may not all agree with me, but I'm going to set the ball rolling. That's what I'm going to suggest that we take as our next major review item, assistive technology, and that we would look at taking the other items as separate points as part of our work programme. But I've proposed something. I'll leave it to colleagues to come in and comment. So can I take Councillor Egginton first, please, if that's okay?
Thank you, Chair. Yes, I accept that assisted living technologies, I think, is something which we could look at, but I think most of the work on that, really, we've already, from memory, had quite a lot of reports on that subject, particularly when you were cabinet member dealing with it. So although I'm sure it's something which is very close to your heart, my feeling is that the promoting healthy lifestyles is perhaps something which shouldn't be delayed. I think it's something which should be looked at now. I appreciate that it may involve some thought and some involvement by officers at a time when they are stretched already, but inevitably these are things which they should be thinking about now. There's no point in looking at this and coming to a report a year after COVID-19 has effectively been controlled. Seriously, in my view, I really think that now is the time to be looking at that. Now, I think we would be ahead of the game, whereas with assisted living technologies, a lot of the work, as I say, has already been done. There may be tweaks and improvements which can be made, but it's not going to affect as large a proportion, in my view, of our constituents, of our residents, as promoting healthy lifestyles. There's so much inequality within Hillingdon. It's probably one of the most diverse. The A40, we all know, is a dividing line in more ways than one. And there is a significant difference in the life expectation of people in the south and the north of the borough. Much more so, I would suggest, than in other boroughs, certainly outer boroughs in London. So that's why I think, and inevitably it's got a slightly higher score than the topic you were suggesting, but that's my view, Chair.
Okay, thank you. Could I bring in Councillor Haggard, please?
Yes, thank you, Chair. I think it's a very, very difficult choice to make because we've got two here that are really important, and ideally if we could do them both together it would be wonderful, because I think that's sort of what we're looking at. I understand exactly what Councillor Eglinton is saying, because you know, we're coming out of COVID, our healthy lifestyles and the gyms and that are open now. We're coming back into that area where we can really actually make an impact. And I think also mental health is included in that. It's a big area and it covers everything. So I'm quite keen to see promoting healthy lifestyles. But on the other side of the coin, and balancing it up, assisted living is also just as important, because we've got people who are coming out of hospital, we've got people who are living at home, they may suffer with all types of things. And I know we have had this in the report before, but we're seeing a much larger number of people being at home, especially vulnerable adults. And it would be very handy to see how we can use the assisted living in also coming out of COVID. So I think they both have actually quite strong input on coming out of COVID. That's what so for me, it's about how can we support our residents coming out of COVID. Both of them are quite high impact, I believe. So I don't really know what I'm going to say. I don't really know which one, because assisted living, it also has a big impact coming out of COVID because it's in the home, and where we've had isolation and everything, we can tell what's happening. So that's my view. I can't say which one. I would like to take them both. Thank you, Chair.
Thank you very much. I'll bring Councillor Gardner in before I come back. I think Councillor Cooper's indicating we'll have another try. I'd love to hear from you on this, Councillor Cooper, but I'll take Councillor Gardner first, if I may, please.
I think it's essential that we do promoting healthy lifestyle following the COVID. I mean, I'm incredibly worried about some of the children that are overweight, some of the adults that haven't had enough exercise. There are also people who are suffering mobility problems who are getting worse because of the them being isolated basically in houses. They couldn't get out to do it. Also, what I would like, and this is quite a big ask actually, where it says the corporate parenting responsibility and early health prevention review, is there any way that we can maybe not do that as a review, but I think as councillors we need to be absolutely sure of our responsibility as corporate parents. I think on this, us on this committee probably know, but I think we need to have a complete definition for us as councillors. So, you know, healthy lifestyle, definitely, and maybe a paper or a couple of papers on the corporate parenting responsibilities. Assisted living, maybe, but I'm more worried about the health of people, to be honest with you, especially people that I deal with. So I have to agree with Tony on that one. Thank you.
Okay. Councillor Cooper, I guess we're going to have to say miss you. Should we have another go quickly on that? Thoughts, Steve?
I'd suggest Councillor Cooper potentially leave the meeting and rejoin, and it may work. Okay, she's gone now, so hopefully she heard that, and she'll be rejoining imminently.
Let's see if that does the trick. I mean, in the meantime, let's pick up on some of those points that have been made. I mean, first of all, yes, we can absolutely take a report on the corporate parenting side and responsibilities. I mean, that's as relevant to me as anyone, as a relative newcomer to the committee, and it's something that I've got to learn about. There's no issue with that, or indeed any of the other options that are before us this evening. I suppose, and as has been said, it is a tough call to make in this set of circumstances. I suppose the issue is the immediacy of the need, I suppose, to make the very best we can of assistive technology to support our health and wellbeing objectives out of hospital. And yes, we have had reports on it before, but really what we've had is related very much to what we're doing with supported housing, extra care, and keeping people living independently at home. There's so much more that can be done. It has so much more potential that we've really sort of barely scratched the surface of thus far. So yes, it is something I've been close to in the past, but and I think the healthy lifestyles certainly is worthy and has merit. But on balance, my feeling is that in terms of what can be delivered now, and in terms of what partners can come to the table and deliver now, the imperative is very much more with assisted living personally. So, very much open to any other views on it. I don't know if anyone else is indicating. I think Steve is trying to see if he can get Councillor Cooper connected, and he's left us for a moment. Is anyone else indicating for now? Councillor Tutwell, can I bring you in the meantime, please?
Yes, certainly, and let's hope the technical difficulties for Councillor Cooper get resolved.
Yeah.
There's merit in all of the topics that have been raised. I know the mental health for young people is going to be covered off by another POC, hopefully. The assisted living, the corporate parenting. I mean, they've all got fantastic merit. And I think all of the comments that have been made so far are all very valid, and it's a shame that we can't do all four reviews. But I hear what you say around what we can do sort of quickly, and in terms of, learning from all of the information that has been gleaned before, and so it might be able to turn some recommendations around quite quickly, which will enable us to maybe spend some time on promoting healthy lifestyles, which might be a more appropriate time later in the year, I think. So that's just this but for me, I couldn't argue with any of them, to be honest. I reckon it's a question of timing, though, Mr. Chairman.
Indeed, I mean they're all very worthy items. Councillor McMahon, you're indicating as well.
Yeah, thank you, Chairman. I think that the comments that I would like to make have all been said already, so I'd just be echoing particularly what Councillor Tuckwell has just said. And Councillor Eggington raised a point about it being resident focused, especially promoting healthy lifestyles. I think equally assisting living technologies is also resident focused, and fundamentally we need to ensure that we are promoting a very outstanding service for our residents. I do think that it is a case of timing, and perhaps even though Councillor Eggington, I get your point about that we need to be looking at coming out of COVID right now, I kind of feel that as it's still a little bit early with only just restrictions being lifted, perhaps it's something that we can review a few months down the line, but certainly keep it on our agenda that it's something we do want some feedback on. But yeah, it's a very difficult decision, I think, to make at this stage, but yeah.
Okay, thank you, Councillor McConnell, thank you very much. Should we admit Councillor Cooper? Let me just do that now, if no one else has. Hello there. Councillor Cooper, are you with us?
I think I might be. Can you hear?
It's a very stuttery connection.
It's a very faint connection again.
But if I may, I just spoke to Councillor Cooper on the phone, and she said she concurs with Councillor Hagger's points that were made earlier. She could hear, she just couldn't speak to the meeting, and gives her support to the assisted living technologies review.
Okay.
Just for that side of
Thank you.
things.
Thank you very much indeed. Well, in an ideal world, I'd want us to have some unanimity on this and some consensus, because, you know, it's important we work together. And there's no argument, as far as I'm concerned, of the validity and the worthiness of healthy lifestyles. Absolutely not. It is really about timing and what can be done now, and where the real imperative lies, given where we are with coming out of the pandemic. So I don't know if you want to come back on any of that, Councillor Egginson, but if it looks as if we may possibly have to go to a vote, which would be, I'd rather not, but if we can't, then we may have to go there. Did you want to say anything else on that, Councillor Egginson, please?
Yes, I accept that there is an argument for looking at assisted living, but as we've already I've mentioned, we already have looked at that. We've had reports on a regular basis. I'm not sure that it's as crucial, as urgent as looking at promoting healthy lifestyles, because effectively the lack of healthy lifestyles has raised the risk for so many of our residents. It's an area where one finds that poor living conditions, overcrowding in accommodation, and no real direction in encouraging a lot of our residents to become fitter, and those who have been isolating and shielding, particularly those areas. I think now is the time to look at that and to try and see what the council can do. We've had quite a lot of funding from central government to help us, and I would have thought that that would be the ideal topic to deal with now. That's my view.
Okay, thank you. Well, look, before anyone else, I say any more, anyone else indicating on this? Okay, fine. All right, so let's try and wrap this up a little bit. It's an absolutely worthy topic, healthy lifestyles, without a doubt. For me, I think if we're having this conversation a few months down the line, I think I would probably find myself concurring with you, Councillor Egginson. This is all about timing, the ability of the health and social care economy collectively, because this involves health partners, to give the level of focus to this that's required now, and particularly bearing in mind where we are with coming out of the pandemic at the moment. We are not out of the woods by any means. The dust hasn't settled by in any way, shape or form in terms of how things will look with people accessing services. There's a lot we don't know about it still. Whereas there's a real imperative on the assisted living side that we can step up to the plate and address now. I do slightly take issue with what you say. We've looked at it before, not really to the extent that we perhaps could have done, you know, and perhaps I should take that on the chin as the former cabinet member, although not for over a year. But I think really in order to move this forward, I'm going to suggest that we do take assistive technology as our next major review. We bring a report back, and I don't think we need to wait months to get something on healthy lifestyles. We can have a report on where we are at the moment to inform our thinking. But I'm going to suggest that we do that. And if we've not got consensus among us, then I'm afraid I'll have to put that to the vote. And you're shaking your head, and respectfully, I think I'm going to have to do that. If there's no other indicators, I'm proposing that we take assistive technology at our next review with a report also back on healthy lifestyles at the next appropriate meeting. I'm going to suggest that as a way forward. Do I have a seconder for that, please? Councillor Tuckwells is seconding. Okay, so Steve, help us out with this. How do we do virtual votes then? Yeah,
of course. So it seems like we have, of the 4 topics that are in the report, it seems like we have 2 front runners, essentially. Yep. So if we just have a vote running through the membership of the committee, and they just say which review they propose.
Okay.
Is the one that the committee
just so everyone's absolutely clear then, the 2 that are being discussed are assistive living technologies and promoting healthy lifestyles. So it's really a question of each member saying which is their preference as we go through. Okay.
Yeah, so would you like me to conduct the vote?
Would you like to run through and each member can indicate, please?
Of course. So I'll start with yourself, Chairman.
Assistive living technologies, please.
Okay, and Councillor McWarner?
Yeah, assistive living technologies.
Okay. Councillor Cooper, if we might not be able to hear you, I'd suggest putting up one finger for assisted living technologies and 2 fingers for healthy lifestyle. That's 1. Okay. Councillor DeVille.
Just in the same.
Yep. Councillor Egginton.
Assisted living.
Promoting healthy lifestyles.
Yep. Councillor Gardner.
Promoting healthy lifestyle, obviously.
Councillor Haggard.
Yeah, assisted living technologies.
Councillor Rodriguez.
Assisted living and technologies.
Okay, and Councillor Tuckwell.
Assisted living technology, Steve.
Okay, so we have 7 votes for assisted living technologies and 2 votes for the healthy lifestyles.
So assisted living is carried then. Can I just say, I mean, I'm genuinely sorry that we couldn't arrive at a consensus there, because I respect all members of the committee, irrespective of their political stripe, and I hope that, notwithstanding the fact that it was necessary to go to a vote on that, I hope that we can still work around assisted living and indeed the question of healthy lifestyles in a separate report, because it's certainly worthy of that airing and discussion. I don't dispute that for a moment. I think with that, I will, with agreement, we will move on to the next item, please. Okay, so thank you very much indeed for that. And then our next item on the agenda is our forward plan, I believe. Can I just say on the forward plan that you'll notice it now goes all the way through to February. So we were talking about getting more information up front. So we're starting to see that now in the way the forward plan works, and it will be very much related to the terms of reference that we have. So we won't have the whole meaty document with things that don't apply to us moving forward. So it will be those specific things. And that's all I wanted to say on the forward plan, unless anyone else has any comment to make.
I do.
Councillor Egginton has raised his hand, Chairman.
Yes, Councillor Egginton, please.
Thank you. Yes, my understanding is that the POCs are going to have the power of proper scrutiny and the opportunity to call in decisions. Is that correct, Chair?
Okay, that is being looked at the moment. I can't give a definitive answer off the top of my head. Steve, can you help on that at all at the moment? Because if not, I may have to report back. Yeah,
I'd say it's yet to be confirmed. So I personally don't know, but it all will be confirmed in May, I'm assuming, at the AGM.
I mean, if I can just add to that, Steve, I mean, I have spoken to Ian Edwards about this, and he shares my view that the scrutiny function is going to be very, very important moving forward. So I think the sort of things that we said we want to look at, and we've spoken about public health contracts, all of those things, we will really want to get into the detail of that. So scrutiny is very much what we're about. But obviously, we will wait for the confirmation that you're seeking on that, because I'm not in a position to supply it at the moment, Councillor Egginton. Anything else on this item at all? Okay. Thank you very much. Sorry, I beg your pardon. Did you want to come back on that? Yes, please do.
Not particularly on that, but on another. There's, on the basis that possibly this, if there are proposals put at the AGM, then I think the AGM will be before the May Cabinet meeting. There's one item here which is to do with the licensing scheme and the consultation on that. I don't know, I'm not sure we've got another meeting before May, before the AGM. Maybe we have.
I think it's the former. I don't think we have, Tony, actually.
No. Well,
no.
I'm not sure how one can, on the basis that perhaps the Executive Scrutiny Committee will disappear and POCs will have, as I mentioned, the scrutiny power. I'm not sure how we are going to be able to look at the licensing scheme which relates to promoting healthy lifestyles, and how that is going to interact with, well, on the basis that there's going to be an extra charge for anybody running events in parks, how that's going to interact with promoting healthy lifestyles.
Okay, and I'm afraid I can't answer that at the moment, Tony. I think the best thing I can do is liaise with Democratic Services and Councillor Edwards and give you a full response on that, and indeed other members of the committee, since you've raised that matter publicly. More than that I cannot say at the moment, I'm afraid.
Thank you.
Okay, but that's noted by Steve, so thank you very much. Can we move on from the forward plan now, please? Okay, thank you very much. And we come now to the work programme for the next year. So it's starting to look much more as it will for the next municipal year. I mean, just one or two observations. I mean, we've got a report on telecare as an update at the next meeting, so I suppose that works and chimes very much with the scoping that we're going to need to take that forward. And I think if you look at the bottom there, you'll see we've added the ETHP and children with SEND, which is one item that we've had some positive news about, and we can really get into some of the detail there at our July meeting. So it's beginning to take shape. I've nothing to add beyond that on the work programme, unless anyone has anything to add. Tony, are you indicating?
So I think that was left over, but I was going to ask whether we should have, assuming that we're still responsible for public health, whether we should have a report on activities from the Chief Medical Officer related to COVID-19. I don't think he did report to us about a year ago, because I remember sitting next to him in February 2020, and we discussed, he then talked about it, but we haven't had any discussion since.
Okay.
And I think it would be helpful.
Okay, as a relative newcomer to the committee, I would have thought that would be a regular reporting item, but Steve, can you help with that at all? Can you offer any advice on that?
Of course, we can add that to the work programme.
Well,
I don't believe it is a regular.
We can add it there, but it's not something that comes as a matter of course. Well, that may be timely given all we've been talking about this evening anyway. So let's see if we can add that if everyone's in agreement. Is that okay?
Yeah.
Okay, lovely. Thank you very much indeed. So that's if there's nothing else on the work programme, I think that concludes our business for this evening. So thank you very much indeed, everyone, for your participation. We've had some good discussion. It's always good. Let's see if we can take things forward positively, and we'll wait now for Steve to stop the streaming.
Okay, the